with that, let me turn it over to Andrew. Andrew, where'd you go?
Right here.
Go for it.
So I know this is sort of a fast-paced session here, but we also wanted to wrap up this hour and a half with a panel, just to try to bring to life a couple of programs that have employed these and similar techniques to drive innovation in terms of the way services are delivered to the citizens of California. Today we have Tanya Homman, who's with DHCS and is the director of the PAVE program. As best I know, I don't think IBM had anything to do with PAVE. But as we looked at the different programs around the state, in terms of examples of applying some of these principles to fundamentally improve upon a process, it really stood out to us as one of the programs that's worth highlighting. So thank you for joining us in this session today and sharing your ideas with us. We have Ken Wolsey, who is a PM with IBM, who's been leading the ConnectWell program down in the county of San Diego, which is a really innovative program for changing the whole model of how care is given to people in the system, from one that's used to be very program-centric to one that's person-centric. And that really allows different departments and organizations that are all working on issues around a given citizen to collaborate more effectively in terms of how those services are delivered. And Karel. I'm going to start with just a couple of questions here, but as you have questions, I hope this transitions from me asking questions to you asking questions so that it really becomes relevant. I guess I'd like to start with you, Tanya, just to talk a little bit about the PAVE program and what you did in that exercise to really delight your customer and sort of change the ways in which services were provided.
Well, thank you. First of all, PAVE is the Provider Application and Validation for Enrollment System. First, you got to understand why I needed a solution. I know that when we hear about applications, how simple can that be, right? You apply for something, you get approved, you move on. And in our world, in government, it's much more complicated than what it sounds. In Provider Enrollment Division, which is what I'm the chief of, it's not just PAVE. PAVE is a portion of what we're transitioning provider enrollment into. We receive about 1,400 applications per month. Paper applications, we enroll about 150,000 providers. We're covering 13.5 million beneficiaries in the state of California, and we spend millions of dollars. So it's very important not only that we have a fast process to get providers enrolled, but that they're eligible providers to enroll, because otherwise we could have ineligible providers providing not so good care for our beneficiaries, but also the loss of federal participation funds in our program. Right now, our application process can take anywhere from 90 days to a couple of years. We go through a very extensive review of the application. Literally every single person listed, all the location addresses are verified. Everything is done manually. We're required to validate against exclusionary databases. We're required to make sure that there's actually a building providing services. Who are they, and are they licensed, and are meeting all the requirements? So it's a very complicated process. It's not just as simple as submitting an application and you're in. So with the Affordable Care Act, there was a lot of change that came about, and a lot more requirements, not only of our providers, but also about on the state. In order to get there, we could not do this through the paper process. And that is exactly why we ventured out onto PAVE. Now, PAVE, we've tried several times to automate the processes in state government for provider enrollment several times, but we're never quite successful. Either, we didn't invest enough in the dollars, the RFP, wasn't very successful, and it just kind of fizzled out. But with the Affordable Care Act, we had no other way. We had to automate, and it actually drove this project to where it's at. But one of the things that we certainly wanted to do is to make sure that we were listening to the experiences of our providers and also of our beneficiaries, because without providers, the beneficiary doesn't have who to go to. And one of the things that we knew is we had a lot of common ground. a lot of the problems that we faced in provider enrollment were also seen by the provider in their side of the world, or, understanding all these forms, all these rules. Who does this apply to? Is this question about me or somebody else? Because we have a ton of different provider types, all fitting into 26 applications. So it was very important, and I don't want to take up all the time because I can talk about this for hours, but it was very important that we took a look at not only our internal users, which are my staff, and also the external users, which are the providers trying to enroll in the program. And we knew early on that without hearing what they had to say, we would not have success. That we can think we know, what the issues are, but until you really listen and talk, you really don't get to the nail of it. And that's certainly something that we've uncovered in PAVE with the help of all my staff in the division, actually giving ideas about, I don't know why we do this. Is it just because? And we found that many of the processes were built that way just because it's paper. So we were able to eliminate some things. And then talking to the providers and hearing from them, what are your particular issues? What are your pain points? And it's not as simple as, oh, it's an application and it just takes forever. There's really a lot more that goes behind it, such as one of the biggest problems our providers have is understanding our processes, our requirements, our forms. So we need to make sure that we were thinking about simplifying, walking them through the process so they don't have to become a Medi-Cal expert in order to have a successful application. But I'll pause that, so that way we can go on ahead.
Great, thanks. And Ken,
Thanks for pausing, or thanks for that
no,
explanation?
we want to get back to thanks for the explanation, mostly, because I think we have some questions probably queuing up around that. But Ken, why don't you also do a summary of the program you're working on as well?
Sure. The Connect Well program is for the Health and Human Services Agency in the County of San Diego. The objective was to change the delivery of services from that of being program-centric, where a citizen would come in and get one service at a time, to being more person-centric, where you could organize the caseworkers around the needs of that person so that you can then fulfill their needs. We saw a really great example of this in San Diego in the probation department, where we had a community transition center for people coming out of the jails. And they would go through there, and the county had co-located caseworkers from all of the different various agencies in health and human services and employment and different areas that were relevant to these people coming out of jail. Well, the net was that recidivism went way down for these people that are coming through this community transition center. It's gone from about 70% down to about 30%. So that really was our model when we looked at it, is how can we take that concept of what was being done manually there and make that available to all citizens with all kinds of different needs. And to do it electronically, you can't co-locate everybody, so you've got to do it electronically, and that's where technology came into play. So we used a lot of different methodologies that we've heard about today in terms of how we came up with this, with the solution and how we have implemented the solution. We brought in people from all the different departments to understand issues like how do you convert from program-centric to person-centric. We looked at privacy issues and authorization. We looked at organizational issues and how do you cross boundaries between the organizations and working together and having collaborative teams to deliver services. We organized joint application design, or JAD, sessions together, and we brought in people that we called our model of practice. These were people from all the various departments who were leaders in their departments, but who had the vision of how to make things better. We took all of that and brought that into our projects. We actually, the contract started as a waterfall project, but within 6 months we converted it to an Agile project because we needed to be able to respond to all these different ideas and things that were happening on the ground there and all the ideas that were coming in from the county. The net is that we've been able to deliver 3 releases as we've gone through the process now. Release 3 is due out at the end of this month on the 30th of November. Each one has built upon the other. We've been slowly increasing and ramping up our workers so that we've been doing it in a thoughtful way so that we can affect change in the organizations, get people using the tools, get people interacting in a new way with their clients, and having better outcomes as a result.
Great. Thanks for that. I guess one follow-up question for Tanya. You mentioned that the organization had made several efforts prior to also improve the process. But this last time, you had a different level of success. And aside from having the ACA sort of mandate to help, was there anything you did differently in terms of your approach or method that you think made a difference in terms of the overall success of the program?
Well, besides the Affordable Care Act, that was truly the biggest driver because the requirements for that participation for federal funds, we could not manage manually. It was just not possible. But it was also a time for change. You know, we've been stuck in government. My boss is not here. We've been stuck in this rut where it's status quo, and we're not evolving. We're not making change. We're boring. We're stagnant. We're non-producing, and it really, truly is time to innovate. We also, with the Affordable Care Act, had the opportunity of 90/10 funding, which certainly helped our finance department to support it. But it really is time for government to change the way it does business. It just can't stay as stagnant as it's been, especially in provider enrollment division, where we have walls of cabinet space holding applications. One application, and if I had my PowerPoint slide, I would have shown you, an application is about this big, and there's about 10 providers that are in that application packet. And then we have 4 stacks this high that is attached to the application, disclosures, verifications. Now, we're dealing with this one application in-house, trying to, move it through the process. Imagine the provider trying to put that together. And 80% of the time, it was returned to provider. So how inefficient were we, right? We were not being efficient, and it was causing impact to our providers. They were required to get admin help or even attorneys to help them fill out the forms. So it was time for change, and I think that with the Affordable Care Act, the FFP enhancements that we received, and truly talking through it's time to change in government, and I think that's what's made it successful.
As you think through the changes you actually made to the process, what change do you think had the biggest impact on the users or the stakeholders?
Leaving the paper world. I think that has been the biggest thing. But as far as developing our solution, we too started off with the waterfall approach, and midway switched to the Agile. And the Agile approach, I think, allowed us to think faster, coordinate better, collaborate with each other, have those small incremental wins as we go through the process. And truly, I think that also helped educate not only my staff, but others in my leadership.
Great. Any questions from the crowd? I think I saw it.
One of the leverage points I think you had advantage of from the ACA was being able to leverage that 90/10 funding. But a component of that, if I'm not mistaken, was the ability to actually carry it downstream and actually fund other cascading efforts, technology-wise, if I'm not mistaken. How often was that taken advantage of, and what were your challenges in presenting that as an opportunity to your partners or peers to adopt the technology to help the bigger picture?
So I got to admit, I am not an IT person. I am the business person, the product owner of this. So my drawing down a 90/10 funding is very limited to this particular project. Definitely, it's very helpful, but I also want to talk about the modularity of this solution that I'm building, because it can expand outward. So I didn't want to think of just building this little box that's going to fit my need today. It needed to be a platform that was agile and expandable for use by other solutions or other departments that do rely on my information, and also that I can expand outward. So while I explained that I receive quite a bit of applications on a monthly basis, we also have a lot of other divisions and departments that have a certification requirement as well, and we receive their transmittals. So, we receive them as eligible to enroll, and then we manage them in the provider master file. I want to get to a point with this solution where I can expand it outward. So I'm starting with provider enrollment division, but I'm going to be going to my sister divisions that do an enrollment function and sister departments that do an enrollment function, so they can utilize the solution that has been built for the state of California that has the foundation of the Medicaid enrollment requirements. So I'm trying to not just limit it to me, but to expand it outward and utilize that funding in order to get us more out there. Does that make sense?
Yep.
Okay.
So a real quick question for the panel, I guess, is that approach that the move that you made from Agile from Waterfall to Agile, how did you manage the change management or getting your project managers, your organization to kind of make that switch with the skill sets and the concepts?
Sure. So one of the things that we had to look at with Agile, because a lot of you have probably heard of Agile chaos, and that happens when you don't manage change. Agile does not mean that you're not managing change. Innovation doesn't mean you're not managing change. So we had to come up with a structured process for change that fit the paradigm of what we were executing in the project. That still means that we had to exercise project management discipline in terms of configuration items, in terms of how you submit the changes, how you make them happen. But we also had to be very agile in terms of being quick to implement change and to assess impact and to be able to make the changes effective. That required also for us to take a look at the project contract and some of our funding. We had to scrape out some funds out of the existing scope that we would apply towards, that were affected by the Agile processes and set up our budgets that way so that we could effectively do change instead of being locked into things by our contract, by, processes and so forth. So the fundamentals of change management still apply, but we just had to really look at embrace change instead of trying to avoid it.
Yeah, I
Completely
might just
agree.
add. I might just add that in our experience across IBM applying Agile, IBM Design Thinking and Agile, the core differentiator was actually having like Scrum Masters that were educated in both IBM Design Thinking and Agile together, and actually doing the work not in the traditional ways of having project management. So if you just have a traditional project manager that you're now going to say, now start to work in an Agile fashion, in our experience, that doesn't work. You actually have to go out and completely, re-engineer the way you think when you're doing this stuff in this way, and have a really powerful leader. And where we've had that, we've had a transformation that was pretty significant.
The other thing we found in our delivery is that it really does require training and sort of a charter on both sides of the equation, right? Both on the government side and on the industry side, because to do Agile well and to do design thinking well, what that really means is those two teams are embedded working together as one team, which I think you even hear it in the opening session today, right? In terms of some of the things around scope battles and the contentious environment that you get between contractor and client in terms of that dynamic. What I really like about the shift to Agile is it gives you the ability to deal with those changing requirements and prioritization and to be able to deal with them in a way that's not contentious, in a way that is more collaborative in terms of really trying to get the mission done. But it does require some different contract structures. I think it does require training on both sides in terms of those techniques. Probably most importantly, it requires sort of a certain organizational charter and agreement that everybody really is in there performing in that way.
Yeah, one thing I would perhaps add is that we really focused a lot on configuration items, not just on words. So, a lot of times requirements, they're stated, but they're very broad. Sometimes they're very general. Sometimes they omit things, and you're constantly elaborating them as project managers and trying to get more detail and drive more detail out. But we really had to focus on configuration items. Have we done that work already? Is there a reason we can't change it to meet the need better? And by focusing on configuration items, that really opened up a lot of opportunity for us because we weren't just locked into this area of conflict where it's, the requirement says this, but you want to do that, so that's a change. We had to look at it a little differently.
And I don't know who heard the opening speakers today, but when they talked about how government, or we, in California, we box ourselves into these contracts. And that truly is a terrible thing for us to do. And that's the beauty of Agile, and that relationship that you do form between the business and the developer is really key. I know in my experience in state government, where we've had certain little side IT projects, and here I'm the business, and then I'm communicating with this entity of my department who is communicating with this contractor who then is communicating to the sub. There, you remember the game telephone line? It never works. And having that very direct, keeping only the provider, or excuse me, the business person and the developer together in a room to really talk and understand each other is critical. It's understanding, communicating fully, learning to speak each other's language, or to at least understand each other's language, because we do speak very different terms. And then having the ability to adjust. You know, you can do, as we did, a ton of requirements, and we're still refining. And being able to be agile in making those adjustments or accepting certain risks to move forward, it should be part of the course in order to be successful.
We have 5 more minutes, so that probably leaves time for a couple more questions. I've seen your hand up. So.
Thanks. You mentioned that you used your schedule, your deployment schedule, to help bring about the organizational change that was needed for the care well. So, 2 questions. How did you balance that with the competing needs for new functionality or changed functionality? And specifically, as a project manager, what else did you do in order to champion the organizational change that needed to happen?
Sure. So in our case, we looked at the schedule and we said, okay, there's certain things on the schedule that are going to be immutable. We have to hit certain points. We have to hit certain milestones. And what we looked at really was that the only thing that was completely immutable was the release dates. We had to hit our target release dates. Everything else underneath could change because we needed to be able to look at different features and so forth. Now, the other thing that we looked at too, which never changed throughout our project, was the scope. And we bounded our scope not just by requirements, but by use cases. And use cases allowed us to look at the bigger picture of what you're trying to accomplish instead of, am I meeting this specific requirement? So we had the mindset all along that we're delivering use cases more than we're delivering requirements. Some, requirements still have to be met, but that's not our focus. Our focus is the solution that comes out through the use cases. And so with those principles in mind, we were able to stay on schedule. If we had, for example, some kind of an idea that needed some development, we could push it back, we could realign it to happen at a later time, and we could bring something else forward. So that when we hit those release dates, we had all the functionality that was envisioned in them, but it was not always in the order that it was envisioned in. Okay? And that's worked very, very well for us in terms of keeping to the schedule, keeping things on schedule. Now, one of the other reasons that's really important is because a lot of times when you're embracing change, you can get locked in endless cycles of discussion. And there can be all kinds of, waiting for a policy to be made before you can actually implement something. We've used the schedule to drive those decisions out. And at times when you don't have a collective agreement, we've had to go in and create position papers where we write it down on paper and we say, this is what we think it should be. Right or wrong, this is what we think it should be. And then we pass that around so that people can interact with it. And that brings us to closure very, very quickly on issues that might take months or weeks to resolve through. Just organizing the meetings can be very hard. So by having these position papers, it helped to kind of solidify the thinking and then drive us forward so that we could have enough decision that we could go ahead and proceed with the software. And then also to help us keep on schedule, we've done a lot of Agile processes call for demos at the end of a sprint. We do daily demos. We look at the software every single day so that we're seeing what's happening, what are the issues, how can we improve it, and keep ourselves on track that way. So those have all been effective tools at managing the schedule.
Time for one more question.
My question's for Ken. You mentioned a focus on configurable items. That's important for me because I'm the configuration management analyst for Child Welfare Digital Services, and right now we're rewriting our change management plan and configuration management plan. Do you guys have any available resources that might be beneficial for my project, such as a change management plan or how you handle what types of items should or should not be configurable items? And is there anything available publicly?
And we can certainly talk about that maybe a little bit more offline, but some of the things that we did with configuration items is we had to, first of all, look at how we define configuration items. Because what we found is that, while one item might be a configuration item at one point in time, at a different point in time, it's not. And so we had to define how something became a configuration item. Then so you're really looking at a life cycle of deliverables, in essence. And as they go through early on, they're not configuration items. As you do more implementation, they become more configuration items. And so then you have to lock into those a little bit more. And you have to look at change in terms of those things. So there's a process that you go through. There's some training we had to give our people. One of the big challenges was to get all of our business analysts to really understand that concept, that configuration items is not just a stake in the ground kind of thing, but it evolves and it builds up over time. Okay, and so we had to look at the process going on in our project. We had to look at the life cycle of the deliverables. We had to look at the work that had been completed, how complete. We had to look at the impact on top of the configuration items. If you're going to make this change, what impact does it have to different configuration items that are in various stages of their life cycle?
Okay, well, we are at top of the hour here. We tried to cram a lot into this hour and 45 minutes, but please join me in thanking the panelists, first of all, for your time. And then let me thank you all for very active participation in today's session. I hope you found it to be a useful introduction to the world of design thinking, and I hope it's sort of armed you with some tools that you can take back to your organizations to try to drive innovation and a more citizen-centric, stakeholder-centric approach to how we perform all of our jobs. So, thank you. Okay.